would just say really keeping an eye on gender and race issues in sports medicine. I think it's just very challenging to be in places where, like I said, there's a high proportion of diversity in the patient population and not in the people caring for them.
Yeah.
So that's a passion for mine, you know, even prior to some of the current stuff that we're dealing with. So I would just recommend the first step is people educate yourselves. The book White Rage is one of my, I would say favorites, but it's not because it's incredibly hard to read. But understanding where America started and sort of how we've gotten to where we are, I think is very important. Um, and I think if people sort of start looking at that and being mindful to some of the differences and some of the experiences that people face, there's also a good book called Whistling Vivaldi, which is about how the concept of stereotype threat, which means if there's a stereotype against you, it almost affects you even if you try not to let it. Like if you're a woman in math, it's like they looked at women in math, and if they just told them beforehand that genders do equally well on this test, women will do better or equal than men, and if before the test they say women tend to struggle with this test, they'll do worse. It's just the concept of like really fighting stereotypes and giving everyone the benefit of the doubt, those types of things. So just as long as everyone's trying to be aware of those things, that's all I can ask.